السلام عليكم ورحمة الله ومرحبا بكم مجددا في محاضرة جديدة من سلسلة محاضراتنا عن مراجعة أسئلة اختبارات البرومترك Review of Prometric Test Question. This is lecture number 31 in maternity and newborn nursing. Today we are going to discuss 5 questions from question number 204 up to question number 208. معكم محمد اسماعيل يحيى. نبدأ مباشرة. Question number 204. The nurse is assessing a newborn who was born to a mother who is addicted to drugs. Which findings should the nurse expect to note during the assessment of this newborn? Select all that apply. The options are number A, lethargy, number B, sleepiness, number C, irritability, number D, constant crying, number E, difficult to comfort, number F, cuddle when being held. وقف الفيديو هنا واختار الخيار اللي بتشوفه صح. The correct options are options number C, D and E. ليه اخترت الخيارات number C, D and E؟ نشوف rational. A newborn of a woman who uses drugs is irritable, may cry continually and be difficult to console. So the correct options are options number C, D and E. Regarding the remaining options, the infant will hyperextend and posture rather than cuddle when being held. This infant is also not lethargic or sleepy. Question number 205. The nurse notes hypotonia, irritability, and poor sucking reflex in a full-term newborn on admission to the nursery. The nurse suspects fetal alcohol syndrome and is aware that which additional sign will be consistent with this syndrome. The options are number A, length of 19 inches, number B, abnormal palmar cursor, number C, birth weight of 16 lb.14 oz or 3,120 gram, number D, head circumference appropriate for gestational age. وقف الفيديو هنا اختار الخيار اللي بتشوفه صح. The correct option is option number B. ليه اخترنا الخيار رقم B؟ نشوف rational. Fetal alcohol syndrome is caused by maternal alcohol use during pregnancy. Features of newborns diagnosed with fetal alcohol syndrome include craniofacial abnormalities, intrauterine growth restriction, cardiac abnormalities, abnormal palmar cursor, and respiratory distress. So the correct option is option number B. Option number A and C and D are normal assessment finding in the full-term newborn infant. Question number 206. The nurse is creating a plan of care for a newborn diagnosed with fetal alcohol syndrome. The nurse should include which priority intervention in the plan of care. The options are number A, allows the newborn to establish own sleep rest pattern. Number B, maintain the newborn in a brightly lighted area of the nursery. Number C, encourage frequent handling of the newborn by staff and parent. Number D, monitor the newborn's response to feedings and weight gain patterns. وقف الفيديو هنا واختار الخيار اللي بتشوفه صح. The correct option is option number D. اللي اخترنا الخيار رقم D نشوف rational. A primary nursing goal for the newborn diagnosed with fetal alcohol syndrome is to establish nutritional balance after birth. These newborns also may exhibit hyperirritability, vomiting, diarrhea, or an uncoordinated sucking and swallowing ability. A quiet environment with minimal stimuli and handling will help to establish appropriate sleep cycles in the newborn. So the correct option is option number D. Regarding to the option number A and B and C are inappropriate intervention. Question number 207. The nurse administers erythromycin ointment 0.5% to the eyes of a newborn, and the mother asks the nurse why this is performed. Which explanation is best for the nurse to provide about neonatal eye prophylaxis? The options are number A, protect the newborn's eyes from possible infection acquired while hospitalized. Number B, prevent cataract in the newborns born to a woman who is susceptible to the rubella. Number C, minimize the spread of microorganisms to the newborn from invasive procedure during labor. Number D, prevent an infection called Ophthalmia neonatorum from occurring after birth in a newborn born to a woman with an untreated gonococcal infection. وقف الفيديو هنا واختار الخيار اللي تشوفه سهل. The correct option is option number D. اللي اخترنا الخيار رقم دي نشوف rational. Erythromycin ophthalmic ointment 0.5% is used as a prophylactic treatment for the Ophthalmia neonatorum, which is caused by the bacterium Neisseria gonorrhea. Preventive treatment of gonorrhea is required by law, so the correct option is option number D. Regarding to the option number A, B, and C are not the purposes for administering this medication to a newborn infant. Question number 208. The nurse is preparing to care for a newborn receiving phototherapy. Which intervention should be included in the plan of care? Select all that apply. The options are number A, avoid stimulation. Number B, decrease fluid intake. Number C, expose all of the newborn's skin. Number D, monitor skin temperature closely. Number E, reposition the newborn every 2 hours. Number F, cover the newborn eye with eye shield or patches. وقف الفيديو هنا واختار الخيار اللي بشوفه. The correct options are options number D, E, and F. اللي اخترنا الخيارات number D, E, and F نشوف rational. Phototherapy is the use of intense fluorescent light to reduce serum bilirubin level in the newborn. Intervention include exposing as much of the newborn's skin as possible. However, the genital area and eyes are covered. Monitoring skin temperature closely, increase fluid to compensate for water loss, and reposition the newborn every 2 hours. So the correct options are options number D, E, and F. The remaining options are incorrect. شكرا جزيلا. نتقابل في محاضرة جاية. Don't forget to support us by comment, like, or subscribe.